Welcome everyone to today's webinar on mental health and climate change. We are so glad you could join us for this discussion. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica. In just a moment, you will hear welcoming remarks from the National Association of County and City Health Officials and the American Psychological Association, followed by an overview of parts of the new report, Mental Health in Our Changing Climate, and an update on some climate change and mental health work from Clackamas County, Oregon. Before we jump into our discussion, here are some brief housekeeping items. This session is being recorded and will be available for on-demand viewing on ecoAmerica's YouTube channel. Please engage with us online throughout our discussion and in the days to come. You can find Climate for Health, ecoAmerica, APA, and NACCHO across social media platforms, and you can tweet about this report and webinar with the hashtag #ClimateChangesMentalHealth. And please use the chat function to ask questions throughout the webcast. You can send your questions to us by choosing host and panelist from the drop-down in the chat box. We'll get to as many as we can. We also encourage you to use the chat function to share climate and health stories from your health departments and connect with each other. But first, a poll. You'll see 3 brief questions on your screen. If you want to fill those out so we can get a sense of who is with us today. All right, exciting to see some of the answers starting to come in. Congratulations to the 50% of you already who have participated. Keep them coming. All right, starting to slow down. If a few more folks want to fill it out, we'll be able to share in a second what the results are. All right. Great if we could share with 82% of precincts reporting. Let's see what the results are. So the questions we were asking was, how much of a priority is climate change for you? We have a small percentage saying not a priority, 20% somewhat important. Half of you, 49%, say very important to you personally, and 29%, so almost a third of you say that it is a top priority for you. And the next question is, how much of a priority is climate change within your health department? 25% say not a priority. So about 24%, so almost a quarter of you say climate change is not a priority in your health department. And then we have 46%, so almost half saying somewhat important. And then another quarter very important, and 4% of you saying top priority. So real, we're asking these questions to see, what are you feeling like? And then what does it feel like in your workplace as well? And is it aligned? And we're seeing it's not quite aligned to how much it matters to you personally and what it looks like in your health department. And hopefully you'll have tools after the webinar today to bring forward in your workplace. And so also, how much of a priority is climate change and mental health within your department, within your health department? So climate change, not a priority, 24%, not a priority for climate change and mental health, 28%. Somewhat important, 43%. So you're seeing like slightly lower numbers, even if climate change is a priority, maybe not climate and mental health. So again, today will be full of tools and resources for you. 22% and 6% saying very important and top priority. So that to me is pretty heartening. We're seeing actually more people say climate change and mental health is a top priority than climate change. So that's a really interesting result. And just thank you so much for starting the conversation with us today. We hope that participating in this poll is going to encourage you to participate in the chat throughout the webinar. So we can go ahead and stop sharing those results. And so yeah, it's good to know we have a really engaged group today. So keep up, introduce yourself in the chat. Let us know what health department you're joining from. And stay engaged with us. So I'm excited now to turn it over to Chelsea Gridley-Smith, Director of Environmental Health at the National Association of County and City Health Officials, for welcoming remarks. Hi, Chelsea.
Hi, Rebecca, and good afternoon, everyone. It is my pleasure to offer a few opening remarks before today's important webinar discussing mental health in our changing climate. NACCHO's mission is to improve the health of communities by strengthening and advocating for local health departments. At NACCHO, we support local health departments, advocate on behalf of local health departments through policy statements, letters to congressional partners, and organizing Hill Days, optimize strategic alliances and partnerships, and encourage member engagement. The importance of resilience and mental health resilience is as important now as ever before. Living through this ongoing COVID-19 pandemic has reignited the need to openly discuss mental health and renew strategies to build resilience during the storm. In July of 2021, the Centers for Disease Control and Prevention released results of a survey of more than 26,000 state, tribal, local, and territorial public health officials, health workers. That survey found that 53% of respondents reported symptoms of at least one mental health condition in the past 2 weeks, including depression at 32%, anxiety 30%, PTSD 36%, or suicidal ideation at 8%. A similar survey was conducted of staff within public health associations and saw similar findings, revealing that public health workers and those who support them are under extreme mental stress and fatigue. The second results are going to be shared by CDC in the coming weeks. So you can see that strategies to build mental health resilience to COVID-19 and climate change have a great deal of overlap. Organizations like NACCHO, the American Psychological Association, and ecoAmerica can leverage each other's resources to our respective members to ensure that public health workers have the tools and support they need to build mental health resilience in their organizations and communities. In fact, NACCHO curated a public health workforce resilience resource library to support public health workers and their building of resilience. Those resources and the ones that you'll hear about today are relevant to those in public health field and those in the organizations that support them. And now I'll hand it off to Howard Kurtzman, Senior Science Advisor at the American Psychological Association, for welcoming remarks from the APA.
Thanks, Chelsea. It's great to be here with the members of NACCHO. APA is a longtime partner with ecoAmerica. It was a pleasure to work once again with our friends at ecoAmerica and with Christy Manning and Susan Clayton on this report on mental health and climate change, which is an update of our 2017 report. The earlier report raised awareness for many people that climate change has impacts on mental health, not just physical health. We're pleased to see that mental health impacts are more frequently considered now in planning for climate change at community and national levels and in the work of public health professionals. We hope this updated report will help advance that work further. There's been a good deal of new research and activity in this area over the last 5 years. A major development is increased attention to inequities. Some groups experience greater mental health impacts of climate change than others, and often those are groups that already encounter other forms of discrimination and inequality. As discussed in the report, these inequities need to be addressed centrally in any policies and programs related to climate change and mental health. The report also talks about strategies for building the resilience of individuals and communities so that mental health conditions can be prevented and not just treated after they appear. You'll be hearing today about these and other topics in the report. We at APA and ecoAmerica are sharing the report widely with health professionals and policymakers. We're using it as the basis for advocating for effective climate policies and programs at national, state, and local levels. We hope that you find the report and today's presentations helpful in planning and implementing programs in your local health departments. We'll be following your work with great interest and look forward to disseminating your successes and lessons learned. In that way, departments and communities across the country can benefit from your experiences as they prepare for and respond to climate change. Thank you. I'll turn it over now to Rebecca Rear of ecoAmerica.
Great, thank you, Howard. And we're going to bring up some slides. Great, so in this section, Christy Manning and I will provide some information that you can find in the new report from ecoAmerica and APA, Mental Health in Our Changing Climate, Impacts, Inequities, and Responses. It is intended to inform and empower health and medical professionals, community and elected leaders, and the public to understand and act on solutions to climate change that will support mental health and well-being. This report has been through extensive peer review and has more than 440 citations. In the next little while, we'll be giving you a bit of context on the connections among climate change, physical and mental health, and some of our attitudes, beliefs, and behaviors when it comes to climate change, providing some information on the impacts of climate change on mental health, the inequitable impacts of climate change on mental health, and the spectrum of solutions available to implement now for different actors and audiences. Now we're going to offer a little context before diving into the explicit impacts of climate change on mental health. On pages 16 to 17 of the report, we provide an overview of the links between physical, mental, and community health, including the image you see on the screen. The important message is that while climate change directly impacts all three, we must remember too that individual mental health is connected to our physical health. The physical health impacts mental health, and community mental health is influenced by both. The image also illustrates that not all Americans are affected equally. There are certain people who are made more vulnerable, which Christy will discuss in a moment. But to illustrate, imagine you're a person with asthma. You will experience more frequent asthma episodes as our climate changes and as we continue to rely on fossil fuels for energy. This can cause you stress and anxiety, and because your activities are more limited, can lead to depression. Given the rise in incidence of asthma overall, not only you, but others in your community may be experiencing the same symptoms. Understanding the interconnectedness can help us better plan to protect our mental health as our climate changes. It can also help us create more effective climate policies that consider mental health and well-being. Another aspect of climate change and mental health is who has access to decision-making levers. For example, if you live in a community experiencing disinvestment, or you are too young to vote, but not too young to understand what is happening around you, you may become frustrated or isolated or feel isolated if you can't influence systemic change. Not to jump ahead to solutions, but I encourage you to think about the ways you solicit and incorporate community feedback into your climate and health plans. Many reports show a rise in concern about climate change amongst Americans. We saw what you all think of it earlier in the webinar. Recent ecoAmerica research found that Americans are reporting high levels of concern about climate change. 78% are concerned, with 48% being very concerned. Yet only 59% of Americans believes others around them are concerned about climate change. And actually, in an updated report released just last week, we saw the gap in actual versus perceived concern grow. So in this more recent survey, 45% say they were personally very concerned about climate change, and only 14% think others around them are. And Nicole is putting the link to that chat, that report in the chat right now. The difference between 14 and 45 is that 3 times as many people are very concerned than people think. And that gap in actual versus perceived climate concern could be contributing to silence on the issue, because people feel alone in their concern and are afraid to step outside of their group's norms. This is called pluralistic ignorance, which is a psychological barrier to action, which Christy Manning is going to pick up now and explain. Christy is the Director of Sustainability and Assistant Professor of Environmental Studies at Macalester College and a lead author on the report. Over to you, Christy.
Thank you, Rebecca. And hello, everybody. I am glad you are all here. And it has been such a wonderful experience to work with ecoAmerica. And I'm really glad to be presenting today with Abe and Chelsea and Rebecca. So Rebecca just left off on the one of the psychological barriers that we see in the research, the psychological research. And as Rebecca just pointed out, most Americans, adult Americans, express concern about climate change, and even more young people express concern. And a majority of adults favor efforts to ensure that we leave a sustainable planet for future generations. But this, unfortunately, hasn't yet translated into the sorts of political and personal actions necessary to take the solutions that we actually already have to scale. There are lots of psychological barriers holding back action on climate. This is what you see on the slide in front of you is the summary of those from a big synthesis of the psychological research. So the first one is psychological distance, and you may experience some of that yourself, the sense that the problem is in the future. It's not really about me in the here and now. People think that climate change is literally and figuratively somewhere out there in the future or far away. And by the way, just Catherine Hayhoe was speaking in Minnesota remotely yesterday, and she named, I was so astonished and delighted, she named these very barriers in the talk that she gave. And Catherine Hayhoe, for those of you who don't know her, is a climate scientist from Texas who is a really wonderful and outspoken voice on climate action and how much we need climate action. The second barrier is belief systems. And we also call it in psychological circles solution aversion. And that's the idea that if my deep belief systems, the things, my worldview that I hold very dearly and identify with, if it is against things like large scale governmental action, and things like a carbon tax, then those solutions are going to bounce back off against my worldview filter, my belief system filter. And I am not going to want to support, not because I don't think we should take action on climate change, but because the solution conflicts so deeply with how I believe the world should work. And this explains in part why a conservative political identity, for example, shows up so often in research as a predictor of climate change skepticism. A third barrier, psychological barrier, is what Rebecca talked about, pluralistic ignorance. People need to feel that their concern and their actions are socially acceptable and supported, in particular by important, close others. And in the absence of this, people are reluctant to talk about the problem of climate change, even though privately they may believe that it is a concern. And you may feel this based on the polls that Rebecca, you shared, that on the polls that you may feel uncomfortable at work if you think that the people around you don't share your prioritization of the climate crisis. Finally, a barrier is the need for efficacy. This shows up in the psychological research all the time. Self-efficacy is the belief that I, as an individual, have the ability to do what needs to be done. And outcome efficacy, sorry, I'm stuttering on my words, is the belief that the efforts of me and of everybody else is going to result in the desired outcomes. Both are needed for changing the political system, making the systemic changes that we need to address climate change. The good news is that the barriers can be overcome. And some of the ways we can overcome those barriers are with visible leadership and action on climate by people that Americans in general know and trust in their daily lives. And this includes mental health professionals and other health professionals. Personal experience with the impacts of climate change, and even better, with the solutions to climate change. If you have personal experience, that closes that psychological distance. And finally, overcoming the barriers can just by helping people see the connection between climate change and their own and their family's health. If we can do that, we can help overcome those psychological barriers. So we're now going to turn to the bad news part of the report, and then we'll end on a more positive note where Rebecca will talk about the solutions. But for the next few slides, I'm going to summarize some of the information from the report that we finished in November and on the mental health impacts of the climate crisis. I'm going to start by talking about severe weather impacts. Then I'm going to move to the slower and more chronic impacts of climate change. Then I'll talk about climate anxiety, and then I'll talk about the inequitable burdens of all three. All right, severe weather events and its impact on individuals. Climate change is creating a whole set of increased severe weather and disaster events. The 500-year floods that are now happening every 5 years, the wildfires that are supposed to happen, not in the rainy season, are happening in the rainy season, etc. Between these things, hurricanes, flooding, extreme rainfall events, wildfires, there is hardly a region in the United States that is left unaffected. And these events, as you might guess, have financial, family, and deeply personal impacts that can harm mental health. For example, direct trauma from an extreme event, from personal injury, from seeing a loved one be injured, not being able to help a loved one, loss of personal property or loss of a pet, loss of one's livelihood, loss of one's home, PTSD have been found to be as high as 30 to 40% among disaster exposed people. And that can last for years, months to years. Other impacts from severe weather events include anxiety, depression, and substance abuse, which can linger for years, increased stress-related physical health problems, and strains on social relationships. So in particular, within households, psychological distress can have serious consequences. Some studies find that violence in the home, including domestic abuse and child abuse, often increases in families who have experienced a disaster. All right. We also see impacts on entire communities from severe weather and disasters. Experiencing an extreme event can uproot an entire community, especially in the case of disaster-induced displacement of large numbers of people, and that weakens social ties. At a minimum, people may be temporarily displaced by a disaster and unable to experience their usual social interactions. This is important because a supportive social context is really essential to physical and mental health. And in the absence of social ties, the sorts of ties that one relies on for material help and just for emotional support, without that support, people are increasingly vulnerable to stress and then associated mental health impacts. And experiencing a disaster so intense that one is forced to leave one's home and community for even a short time, but for a longer time in particular, it's really traumatic. And displacement has been linked in studies to higher rates of PTSD, along with other negative mental health outcomes such as anxiety and depression. And losing one's community, either because it was leveled by a wildfire or by a flood, or it may still be there, but one can't return to it because of the disaster. So one has been displaced. It threatens people's sense of identity and their sense of belonging, in addition to their sense of being part of a social community that lifts them up and keeps them going. And now we're going to move on to the chronic impacts. All right. People are often not aware that the chronic impacts of climate change are also dangerous to mental health along with physical health. The three types of chronic impacts that we focus on in the report are heat, drought, and poor air quality. Heat affects mental health because it is a physiological and psychological stressor. There's abundant research on this. Increased temperatures are linked to mood and anxiety disorders, to schizophrenia, vascular dementia, and greater use of emergency mental health services. Drought causes enormous psychological distress, including generalized anxiety and depression. And this is particularly true for farmers and farming communities or other people who are economically affected. Their livelihoods depend on stability in the climate and in the the weather systems year to year. You can probably think of lots of occupations that depend on that. And prolonged drought has actually been linked to increased farmer suicide around the world, including in the United States. The factors that contribute to climate change, now we're moving on to air quality, particularly the burning of fossil fuels, also contribute to air pollution. And one big problem is particulate matter, increased particulate matter. I see it on my phone when there's a bad air quality day. So air pollution can increase the risk of anxiety and other mental disorders. And perhaps more insidiously, it impairs cognitive function and predicts lower ratings of happiness and life satisfaction. So you may not even know that air pollution is impacting you, but it is. It's lowering your mood and lowering your sense of happiness. There is also evidence that air pollution has long-term impacts on children's cognitive development and their long-term mental health. So finally, two other ways that these chronic impacts of climate change affect people's mental health, the heat, the drought, and the air pollution, changing air quality, is by affecting the places that people live so dramatically through, for example, sea level rise or loss of the usual species. People lose their sense of place, and we each are connected to the place that we live. It's part of psychological health, is to have a sense of, this is my place, this is where I belong. And we lose that as the climate changes the places that we live and love. And this can impact not just my attachment to the place, but also my sense of self and my identity. And it impacts people's sense of control over their lives, which can be really uncomfortable to lose that sense of control. And then impacts on communities of these chronic long-term changes. This has been studied in particular in cold climate Indigenous communities that have been affected by rapidly rising temperatures. People lose their culture and their traditions. People who rely on cold temperatures and sea ice are no longer able to practice their usual cultural practices and traditions. And Indigenous people in particular often report a really strong attachment to the land, even a sense of relationship to it. And it can be important, as I said before, to traditional practices and traditional foods. So these warmer temperatures are preventing that usual cultural practice. And then a second community level outcome is an increase in hostility and conflict. And there is also quite a bit of research on this. Rising temperatures are linked to not just as I said before, an increase in hostility inside the family and inside the house, but also interpersonal aggression and violence. That aside from domestic violence, we also see an increase in assaults, rapes, murders, violent crime in general as temperatures rise. And converging evidence suggests that climatic changes may be a contributing factor to other types of intergroup violence, such as political conflict and war. And now climate anxiety, the last slide that summarizes the hard findings from our report. Even among people who haven't experienced directly the impacts of climate change, just awareness of the problem may be accompanied by negative emotions, including fear, anger, feelings of powerlessness, exhaustion. I see this, I work with college students, and I see this regularly among my college students. A 2020 survey by the American Psychological Association found that about 2/3 of respondents said that they felt at least a bit of this kind of anxiety and about 1/4 of respondents said that they felt a lot. Negative emotions about the climate crisis don't constitute mental illness. However, watching the slow and seemingly irrevocable impacts of climate change unfold and worrying about the future for oneself, one's children, and later generations may be a source of stress and sadness. And this is often called climate anxiety. And there are quite a few terms out there. I think the research is settling on climate anxiety as the best name for this, but we'll see how the research continues and what results as the agreed upon term for what we're calling it. This climate anxiety is more prevalent from the research among younger adults. And we've also seen some international research showing that negative emotions about climate change are associated with lower mental health. All right. So that's the summary of the findings of the report. And now I'm going to talk about how those impacts are inequitably distributed. It's important to note that what I was just talking about, these destructive impacts of climate change, are going to be felt by everyone in some way. The burdens are going to fall most heavily on those oppressed by historic and present day social, economic, and political power dynamics. Climate change is a destabilizing force, and it exacerbates pre-existing socially determined vulnerabilities, making some populations more prone to mental health difficulties. So the first group that we highlight in the report are those who are economically disadvantaged. Living in poverty is a risk factor all on its own. Just living in economically disadvantaged circumstances is linked to poor physical health, greater likelihood of being the victim of a crime or some other form of violence, and a higher risk of depression and anxiety. And individuals with serious mental health illness already may be more likely to be unhoused or less likely to regulate their own behavior in response to dangerous environmental conditions, such as an approaching extreme storm. If you add to this the fact that the economically disadvantaged are more likely to be exposed to a disaster because poverty pushes people to live in areas with higher disaster risk. And in addition, in the aftermath of a disaster, those with lower wealth have less access to the material resources that normally help people cope and recover. All of these factors contribute to the higher risk of stress, depression, and anxiety experienced by poor people after a disaster. The second community that we highlight in the report are communities of color. And this comes down to discrimination and systemic racism historically and in the present day in the United States, which exposes racial and ethnic minoritized populations to a wide array of environmental risks while simultaneously denying them access to the financial and political resources that would otherwise help buffer the impacts. One stark example of this is how historical discriminatory housing practices, such as redlining and racially restrictive covenants, have forced people of color to live in dangerous heat-prone areas. And there was a recent research in the last couple of days also highlighting flood-prone areas for same dynamics, forcing people of color to live in heat-prone and flood-prone areas. So formerly red-line neighborhoods in the United States tend to have lower tree cover, less green space, more concrete, which all makes them significantly hotter. And this not only increases the health risk from high temperatures, but also deprives these communities of the mental health buffer offered by green space, urban green space. And disinvestment in urban areas with high concentrations of people of color has led to outdated infrastructure, such as inadequate warning systems for extreme weather, poor flood preparedness, clogged or deteriorating storm sewer systems. And these infrastructure failures expose residents to more of the physical impacts of climate change, which in turn makes it more likely that their mental health and well-being will be affected. All of these factors put a heavier burden on Americans of color, making them more susceptible to the depression, anxiety, and psychological distress brought about by climate impacts. The third community that emerged from our research is Indigenous communities. And I already mentioned that the Indigenous communities of the Arctic in particular, but Indigenous communities that are impacted by climate change are found around the world. In Alaska, another Arctic community example, villages are literally vanishing as permafrost thaws. And in the Gulf Coast, their houses, entire towns are disappearing while the shoreline is eroding. And as I already mentioned, displacement, being forced to relocate because of climate change, or even just thinking about it, causes significant stress. It weakens social connections and it increases levels of conflict within a community. Climate change threatens Indigenous ways of life in numerous other ways as well. The connection to the land through history and lived experience is important to the personal and cultural identity of many Indigenous people. And when the land is irrevocably altered, it really impacts people who are connected to that land. Shifts in climate and weather also affect Indigenous communities' food security, and as I already said, their traditional cultural practices, their attachment to place. So it's not surprising, but it's still very troubling that a recent systematic review of the research indicates that suicide, depression, and anxiety among Indigenous populations in North America are linked to both acute and chronic weather events. All right. Now, children. Nearly half of the world's children, about 1 billion, currently live in countries considered to be at extremely high risk of exposure and vulnerability to the impacts of climate change. That's a lot of young people. There's no question that experiencing a natural disaster or having to be displaced from one's home exposes a child to high levels of stress. And this has lifelong ramifications. It can affect the development of the neural pathways in ways that impair memory, executive function, and decision-making in later life. And it can result in higher levels of anxiety and depression over a long course of time. Climate change-related disasters affect children directly through the stress and trauma of an extreme event. Some studies find that children experience PTSD to a greater degree than adults. And climate change impacts children in less direct ways as well. For example, their schooling may be interrupted, and they may also be impacted vicariously through their mental health impacts on their caregivers, their parents, their grandparents, their teachers. Food insecurity is exacerbated by climate change, and malnourishment during the early years of one's development is associated with later behavioral and motor problems, lower intelligence test scores, fewer years of schooling, and reduced economic activity. Children are especially vulnerable because they rely on others, their parents, their social connections, their communities to ensure their well-being. Children on their own have very little power, political, social power, economic power. Research that my colleague Susan Clayton was involved with, it's an international study, shows that young people around the world are experiencing climate anxiety. And they feel that adults, and the adults in government in particular, are failing them or betraying them by allowing climate change to threaten their futures. So finally, some additional populations to note before I turn it back to Rebecca for the solutions. In our report, we describe a number of other populations who have been made more vulnerable to the mental health impacts of climate change. These include elderly people. This is in part because physiologically, elderly people are less able to withstand heat, And because, like people who live with a disability, they often rely on services that become unreliable or unavailable in extreme events, such as mobility services, which maybe can't reach a person during an extreme storm, a flood, whatever. Women are harder hit by climate change, in part because they tend to have greater caregiving responsibilities. Extreme weather events are also associated with an increase in intimate partner violence against women. People with pre-existing mental health diagnoses are at greater risk for a number of reasons, one of which is that some medications for mental illness increase susceptibility to heat. And then finally, in our report, we talk about the significant risks faced by outdoor workers. And note that about 75% of outdoor agricultural workers in the United States identify as Latinx. So thank you for bearing with me as I summarize this somewhat hard news, but I now turn it over to Rebecca to share some of the solutions we talk about in the report.
Thank you so much, Christy. So while the impacts of climate change on mental health are profound, solutions are abundant and accessible. I have to emphasize this: climate solutions benefit mental health. This includes improved mood, social behavior, cognitive function, academic performance, and the senses of control, agency, and well-being, and reduce stress, anxiety, depression, and post-traumatic stress disorder. Local solutions can also enhance community cohesion and resilience. And I know, we're ending on this, Abe will come after me and I'll introduce him in a moment, but it's so important that we, in order to communicate climate solutions, we do have to ditch the doom and gloom. And so that's why we've structured this webinar in a way that we are presenting you with a lot of information that's really important to know and digest, but we're ending with solutions and tangible tools to move forward. So I hope you're getting that sense from us today. And so in the report, we detail resilience and solutions for individuals, climate actions we can each take to bolster mental health, which can also be helpful for mental health providers and health professionals who support others in building personal and household resilience. But today we wanted to focus on promoting resilience in communities, sticking with the public health approach, framing a lot of the work, framing a lot of the work in health departments. A strong community can be a source of stability and safety for its residents. All humans fare better when they perceive the world around them as orderly, predictable, and benevolent. And as we know, an individual's ability to mitigate disaster risk is profoundly shaped by policies and decisions made by those in power at the community, state, and federal levels. With that in mind, we've put together a set of suggestions for how communities can create conditions that make life better for everyone, in particular those who have been made most vulnerable in the past. This includes steps like expanding response and resiliency plans, addressing inequities, strengthening mental health services, updating physical infrastructure, and developing an effective and accessible warning system. Meaningful local climate solutions are within reach. Communities can take thousands of actions on climate that benefit mental health. Here are a few ideas to get started. Inspire change by making a public commitment to climate solutions and feature it online and in all of your communications. Focus on the benefits and cost savings that people in the community will realize with the solutions and how investing today will make the community stronger tomorrow. Aim for quick successes with easily achievable and affordable steps that can be put in place quickly. Establish priorities and make informed plans with goals for energy efficiency, renewable energy, electric and active transportation and mass transit, waste reduction, sustainable purchasing, and natural infrastructure like tree canopy, green spaces, and sustainable agriculture. There are partnerships that you can make with local environmental groups to have that natural infrastructure put around your health department. Engage and communicate with leaders in businesses, education, mental health, and faith, those who are already making commitments to climate solutions in ways that are non-politicized. And more information, of course, can be found in the report. Mental health professionals can do any and all of these steps already covered. The way these steps are written in the report are framed for mental health professionals, but please see yourselves in these steps. As local health leaders, your community looks to you for information and advice. You can learn and stay up to date on climate change and the impacts on mental health like you're doing today. You can stay in touch with any of the groups on the webinar for ongoing updates and support. Engage other health and mental health professionals to share your knowledge or collaborate with them on programs or research. Connect with each other in the chat right now if you're seeing people join from your region. Be visible and vocal leaders within local communities by giving talks, participating in events, or serving on planning committees for resilience or climate action plans. Support national and international solutions. Again, thinking about what you can implement and building on that for large-scale systemic change. I'd like to end this section with an invitation. Please join us at the 11th Annual American Climate Leadership Summit, which will be held fully virtually from March 28th to 31st. Day 3, March 30th, will feature a full day of climate and health content, and we will also continue discussing climate change and mental health in a featured session. Thanks to the APA, not to steal Howard's thunder, but you are all invited to attend with a complimentary registration code that Nicole is going to share in the chat now. We can, continue this conversation and continue the support for your action. And so I just want to now introduce, speaking of local action and local health departments implementing change, I'm honored to introduce Abraham Moland, Health and Transportation Impact Planner with the Clackamas County Health Department of Health, Housing and Human Services, to talk about the work he has done there on climate change and mental health. Over to you, Abe.
Thank you, Rebecca, and thank you, ecoAmerica, for the opportunity to join this conversation. I'm really excited about that discount code. So that's very exciting news for me as I start this presentation. I'll be sharing a little bit about our process on incorporating mental health impacts into our regional climate and health monitoring work in the Tri-County region in Oregon. So it's collaborative work between the Multnomah, Washington, and Clackamas County Public Health divisions, 3 counties that make up the Portland metro area. I also want to highlight that our latest reporting work was generously funded by NACCHO through their Climate and Health Adaptations and Local Public Health Department grant. So climate change is a major public health concern for our region. In a 10-month span alone between 2020 and 2021, in Clackamas County, we felt the impacts of severe wildfires that forced evacuations, ice storms that cut communities off from power and essential services, and an unprecedented heat dome. This photo shows the drastic impact that the wildfires had across our state of Oregon, and we expect there to be more instances of extreme heat, poor air quality, and severe weather. And for this reason, it's imperative that we adapt our essential public health services to include monitoring the threats from climate change, essential public health service number 1, in order to mobilize partnerships and plan interventions to address them. And this is the goal of our regional climate and health monitoring report work. So this report provides annual data over the past 10 years on 12 different conditions over 5 impact areas specific to our region. And when we shared the benchmark report in 2019, one of the most common questions we received was, how can we measure the impacts of climate change on mental health? So when we updated the report last fall, one of our goals was to begin tracking mental health impacts and identify some potential indicators. We started with literature and best practice review of mental health impacts. We also supplemented this with conversations with state partners that were working on the topic. And this graphic is a simplified version of how we categorized mental health impacts over the short, medium, and long term, and it reflects the balance between acute and chronic impacts that Christy was describing. And since our monitoring report focuses on annual trends over time, we wanted to measure impacts more on the long-term chronic impact side of the spectrum. And throughout the process, we established 6 criteria to evaluate possible indicators to include in the report. So this include readiness. We wanted to be the indicators be ready without a lot of processing, comparability over time. We wanted a baseline of data, something with 3 to 5 years at least, geographic specificity to our 3 counties, a clear causal linkage that connects the mental health outcome to climate change drivers, and then an equity lens and something that would allow us to disaggregate the data and prioritize subpopulations that are impacted most by climate and climate impacts on mental health. And so we did a wide review of possible data sources and indicators, some of which you see on the screen, but we ultimately didn't adopt any as official indicators for our report because there were just limitations with each of them with our criteria that we established. So we didn't find any, and we realized there's no billing code for climate anxiety to trace clinical mental health outcomes, and often the mental health impacts of climate change are masked and present with other general mental health conditions. And then we're also working with a general lack of visible indicators on mental health and impacts of trauma in our society overall. So we did include some data from the Yale Climate Opinion Survey and the Oregon Healthy Teen Survey, the yellow and red dots that you see on the screen, as kind of landscape existing conditions points to show related impacts, but we make it clear that they are not climate-related health impacts in the report. So this is data from the Yale Climate Opinion Survey, which is great work. It's modeled data, which is the biggest limitation for us in our health outcome reporting. But it includes great insights on trends in perception of worry related to climate change. And so the 3 data points on the screen are the estimated percentage of people worried about climate change, percentage of people who think global warming will harm future generations, and percentage of people who think global warming will cause personal harm, all specific to Clackamas County, available at the county level. And so the general trend that we see here is that over time, more people are worried about that global warming will cause some form of harm, and a majority believe it will cause harm to future generations. And this is data from the Oregon Healthy Teen Survey that specifically looks at 8th and 11th graders' self-rating of general emotional and mental health. And this isn't specific to climate change, but we wanted to include it because we know youth are a more vulnerable group to climate change mental health impacts for all the reasons that Christy highlighted. And the general story here is that between 2011 and 2019, in every county in the region, for both 8th graders and 11th graders, the percentage of students that report excellent and very good mental health went down, and those that report fair or poor mental health increased. So that's not a very resilient foundation to layer climate anxiety on top of. So to wrap up, some of our next steps on this monitoring work are to build the surveillance system that we need to check mental health outcomes and blend mental health questions into existing assessment tools like ongoing community health assessments and climate adaptation plans. There are a lot of tools that evaluate impacts to specific events, but not many consistent long-term data collection mechanisms. And so this could look like adoption of some of the data points that we just looked at, but also we want to carve out space for qualitative data and narrative and stories to include an ongoing monitoring work. And we want to take what available mental health data we have to make the connection and case on mental health and climate to inform our climate action planning work and response plans. And then finally, we want to continue partnership development with behavioral healthcare systems, healthcare providers, and community-based organizations to work on this issue. So with that, I will introduce Nicole Hill, ecoAmerica's research marketing manager and one of the lead authors on the ecoAmerica mental health report, to facilitate some Q&A.
Thank you so much, Abe, for sharing all of that. We have about 9 minutes left and a lot of really great questions from the audience. So I'm just going to jump right in with the first question. What differences have we seen between adults and children in the mental health ramifications of climate change? And what protective factors do we need to bolster? Somebody also just asked how we can help repair mental health for children after disasters. So if we can combine those two, that would be great. I'll direct the first half of that question to Christy, and then Abe, if you could address the protective factors, that would be great.
I'll sum it up really quickly, briefly, in that the children are more susceptible because of their dependence on adults and because they are potentially physiologically more susceptible to heat and other things. And then we are really seeing a spike in, maybe not a spike, but an increase in expressions of a worry about the future among young people. So I think that this is a trend we need to continue to watch because it's also something that is really important for youth. Take it away, Abe.
Yeah, I really only have an example of one protective factor. So Christy, feel free to fill in the gaps that I'm leaving around this, but I think it's important to create opportunities for youth to engage in climate action. And our partners in the county sustainability department have created a youth advisory task force as part of their climate action planning process, which allows youth to engage in that and connects directly to the larger task force around the plan. It's a great way to empower youth and show them that there are still adults that are trying to preserve the future, even though it doesn't always look like that. And so hopefully it's a way to promote better psychological health and fortify and instill a sense of hope and empowerment for the future generations.
Thanks. I just added in the chat for anybody who's interested a link to the Clackamas County Youth Advisory. They have a little video and I definitely recommend watching it. There's lots of powerful words from the folks on that task force. Our next question that just came in from the audience is, and this is for all of the panelists, when disasters like the ones that we're talking about happen, how do we connect individuals to nature and its healing properties? Anybody that has thoughts on that, please take it away.
I'm happy to give my 2 cents, but I would also defer to Chelsea and Abe. All right, so yes, connecting people to nature it's enormously helpful and healing, both in terms of the mental health benefits that it confers, and also it is motivating, right? To know be connected to what we also want to protect. And some of the things that we don't talk about so much in the report, but there's lots of good work out there in greening urban areas, increasing people's access through making transportation more accessible to take people to nature areas, or increasing the nature areas that are right there in people's backyards. So there's lots of good work going on out there. And I don't know, Chelsea and Abe, if you have other examples.
I'll defer to Abe first.
Yeah, it's kind of taking off my climate change hat and putting on my health and transportation impact planner hat, and really just like leaning on the importance of cross-sector collaboration to look at park access, opportunities for physical activity, and really bringing green space into our local infrastructure and making sure that it's targeted in the areas that need it most. And so building those relationships with city planners, county planners, urban planners, to be able to show up and be aware of the opportunities to advocate for more green infrastructure and park access.
Perfectly said.
Great. So this next question is about climate anxiety. And again, I'll ask everybody for their input. Anna asks, it seems to me that climate anxiety is a perfectly reasonable response to the news and what we're seeing. So how do we as a society validate that instead of framing it as something that's unusual or unhealthy? How do we validate what people are feeling today?
I absolutely agree. And I think this is a developing conversation among researchers and mental health practitioners, right? Is acknowledging, because in my experience, and I'm not a mental health practitioner, I'm a research psychologist and academic, but just the hearing students, young people's concerns and validating them is helpful to them, and they're feeling like, okay, somebody understands where I'm coming from, and it really is it's a perfectly reasonable response to reading any news or science about the climate crisis. Howard or Chelsea or Abe, do you have anything to add?
Well, you didn't call on me, but I'll, if you don't mind, I'll add something, which is, acknowledging, someone's anxiety, I think it goes a long way, like you were saying, but having, we mentioned faith communities and our ecoAmerica, I'm the director of our health program, but we also have a faith program, and they talk about eco grief a lot and lamenting. And there are, if you're a member of a faith community, that's an outlet. And so that's just one example in our Blessed Tomorrow program of people building the space to grieve for lost places. And there are probably non-denominational or non-religious ways to do that too, but to still kind of go through that process of acknowledgement, but also like allowing the space to grieve. And then that acknowledgement also, I would just, one of, you mentioned skepticism and those psychological barriers to action. And one thing that ecoAmerica, one resource we have is a Let's Talk Climate guide, which also, we talk about acknowledging ambivalence. So this whole concept of acknowledging and meeting people where they are, and, starting with people is a big way to connect. And so acknowledging ambivalence, acknowledging skepticism, we might not all agree. We might not, because some of people's anxiety is fueled by this division and inaction. And if we can acknowledge some of that ambivalence or some of that skepticism, it can actually go a long way. And then in working towards common ground and working towards solutions. And like we heard, being a part of the solution can actually go a long way in addressing anxiety. So it was a little roundabout answer, but I hope that also provided some tools to help answer that question as well.
Thanks, Rebecca. Would anybody else like to add to that before we start to wrap up? No? Okay, well, we have other great questions, so I'd love to keep going, but we only have about 1 minute left and it's time to wrap up. So I've really loved the QA session. This has been an extremely energizing conversation. And I want to say thank you to all of our speakers. Thank you to NACCHO for helping spread the word on mental health impacts of climate change. Thank you also to everybody who's joining today. We do have 2 upcoming opportunities to tune in with us again. The Climate for Health and ecoAmerica will be at the NACCHO Preparedness Summit in early April, and you can sign up to take the Climate for Health Ambassador training, which equips health professionals with the knowledge, resources, and experiences to act confidently on climate change solutions. And you can also join us at ecoAmerica's American Climate Leadership Summit, which Rebecca mentioned. It's March 28th to the 31st. You can register with the free code that's in the chat. It's a free American Psychological Association code. So we really hope to see you there. Thank you again for listening, and please join me in caring for ourselves to care for our planet. We'll see you soon.
Thanks, everyone.